Thank you. Next is Irene Eckstrand, NIH.
Thank you for inviting me here today. I appreciate that. I'm going to try to make some different comments because I'm sure that you have heard many things many times today. I think I was asked to contribute because I manage the MIDAS program. That's an NIH-funded program that develops computational and mathematical models of infectious disease dynamics. So I'm going to be speaking from that perspective. In the 8 years since MIDAS first was funded, we've learned a lot about the value and the limitations of modeling and computational analytical modeling for research scientists, for public health experts, for policymakers. And as a result of many discussions, I think we're all in a much better position to discern how models can be useful for whom and in what situations. Now, I want to just talk a little bit about modeling in context because that's going to play into some of my comments later on. We all have models. We use models all the time, whether they're based on our own idiosyncratic experience. And I'll tell you one of mine is that I do believe this stage is flat right now. And were I to walk across it, I would be worried and might not make it across if I was thinking about the curvature of the Earth and how that affects the stage. So my day-to-day model as I'm getting around town is a flat Earth model. I know it's wrong, but it really works for me. There are other cases when I need a much more sophisticated model because of the kinds of questions that I'm dealing with. You know, a map is a good model of how the roads work geographically, even though it isn't reality. And so the question, I think, is not whether to model, but what kind of model we're going to use, whether it's an explicit model that we understand clearly, where we can all define what our assumptions are and what the values are that go into it and how we're going to parameterize it, or whether we're all going to come to the table with various mental models. And speaking of mental models, I think that brings me to the data problem. I don't want to minimize the data problem at all. The data problem is a huge problem in biological sciences. Whether you go to systems modeling of molecular pathways in cells, or you talk about large-scale epidemiological modeling, infectious disease modeling, data, we are awash in data, and yet we don't have enough. So I don't want to minimize that problem, but I will say that the lack of data also affects all of our models, whether we're talking about computational models or mental models. We all have models for how diseases work, and they're all informed or not informed by our lack of information. Now, MIDAS itself does not have a vaccine model that's equivalent to SMART, but I did want to make the comment that I think there are some ways that MIDAS models, large-scale epidemiological models, could conceivably interact with SMART, and I want to mention a couple of those because they may be of some interest to you. First of all, I can imagine that SMART does not have to take account of everything because we have epidemiological models that generate a lot of information. So demographic information, how that interacts with disease information, those are things that get built into our epidemiological models and are certainly available to be a foundation for SMART decisions. Another resource that MIDAS could conceivably provide to SMART, if it's interested, is our synthetic populations. So we have, and they're becoming more widely used, synthetic populations of the United States, parts of Mexico, Thailand, England, and we're working on the rest of the world step by step. These are populations that are statistically exactly indistinguishable from the real thing for every measure that we can figure out. So it takes account of businesses, where schools are, how children go to school, what the transportation networks are, the demographics of households. All of that information is built in. We're working on building populations that actually age, so you can look forward in time. So those are resources that are freely available. They're publicly funded, and they're certainly available to to the developers and to the IOM if you care to use them. The other points I wanted to make were first of all, about software hardening. Midas has found that it's very difficult to get scientists together to build really robust tools. I think it almost takes people who have expertise. It does take people who have a lot of expertise in software hardening and in software engineering to actually do that process right. And that process is far more difficult and far more expensive than building the fundamental model. That's the bad news. You want to be sure that when that model goes out to the public, that it's efficient, that it's robust, that it performs the way you want it to, and that people like me, who sit at my desktop, aren't going to break it like I break Word every now and then, right? So that's going to be an expensive proposition, and I think it's worth it to be aware of that right up front, that you're talking probably of hundreds of thousands of dollars to make a robust code. That said, I'm really enthusiastic about it. I'm enthusiastic partly because I think simplicity is important, and it's important to try to hone a very complex situation down into its critical pieces. And one of the real values of modeling is forcing you to discuss what's really, really important here and what's not. Creating the right model with the right kinds of information, with the right attributes, with the right formulations for the particular problem you're trying to solve. And that requires a process of simplification rather than a process of trying to recreate reality in a computer. That's just not going to work, and it's not a good use of models. The last thing I wanted to mention was the importance of training. We've talked a lot about how the end users are going to use this. I can imagine a lot of your end users are likely to be people who aren't computationally savvy. And I think it would be wise to build into the budget for development of this product plenty of money for training people on how to use it and how it can be used to make support better decisions. And with that, I will stop.
Thank you. Timothy Lant.
Thank you. So after a long day, I now have about 116 bullet points to cover, so I hope no one's getting tired yet. My name is Tim Lant, and I'm the Director of the Division of Analytic Decision Support from BARDA, and so I have the privilege of following up with Dr. Robin Robinson from this morning, who's covered a lot of the contextual components for how we go through some of our prioritization processes. So what I'd like to do is spend an opportunity to try to give some direct feedback on the Smart Vaccines program from some methodological issues, and also as it relates to some of the experiences of going through modeling projects writ large, and some of the elements that come into that I think are important. Probably many of them are known from the committee, and I acknowledge that as well, but I think it's important to be very explicit about them, put them on the table, because although much of these arguments are semantic arguments, there are semantic arguments that matter, since we use a lot of the same language to describe many, many different things. So first, to sum up, I think the panels throughout the day have essentially provided three important types of information today. The first is what modeling questions they would like to have answered writ large, in the sense that these are questions that we don't know the answers to, and they're considered to be complex or quantitative questions, but they might be beyond the scope of what the Smart Vaccines project could do, despite how ambitious it is. The second thing that's been provided by the panel today is insight into how complex the decision-making processes are within this space, the number of decision makers and the competing interests that they all have within an environment of limited resources. And then the third thing that we've heard today are some of the hopes and reservations about the Smart Vaccines project. These should be construed as comments that are relevant for what it is that the committee is attempting to do with this work. and also what some of the reservations might be about seeing modeling results. So within that, I think if we can focus on the hopes and reservations for what's a reasonable effort with this project, we'll be much better served. So to focus in on the questions at hand, I'd like to address usefulness and usability somewhat together because I consider the use issues to be parallel. But one question that's come up repeatedly throughout the day, but I don't think it's been addressed as directly as it might be, is the specific identification of what the decisions are that the decision support tool is attempting to support. There's also an embedded model, and models can answer questions, but we do, I believe, need quite an amount of rigor in the specific identification of decisions that are being supported in tools, much in the same way that we're asked to identify specific questions in research. So rather than research questions that provide answers to unknown phenomena, decision support tools should identify the decisions that they're aiming to support, and in so doing, you have a way to measure whether or not you have a useful tool, because the measurement of usefulness should rely on how well you can support those specific decisions. So I think that's critically important in terms of going forward, and it opens up a number of other issues related to usability. I don't want to go into them in too much detail, but I do want to mention several. So one is the issue of false precision, whether or not we're presenting results that are more accurate than the data warrants, which I think in many cases can be an issue. The second is whether or not this tool is intended to be a black box or not. There's an argument for and against having black box models, but that issue should be addressed directly. I know that the choice of the multi-attribute utility theory supports a very transparent architecture, so within people who are used to working with this quantitative information, it's easy to grasp what's being done at a high level. It might not be easy to grasp what's being done at a slightly lower level. One very good example of that is there's a control for data entry related to herd immunity. Herd immunity is a very complex mathematical phenomena that Irene and her group have been struggling with for years, and you can put 10 modelers in a room and let them debate herd immunity for hours and they still won't agree. So a couple of other issues related to use. Another important issue is, that comes up is whether or not this model is predictive. It will be asked, it's one of the primary questions that modelers always get, is whether or not you used a model to predict or not, and if not, what do you use it for? What happens in that setting, a lot of times people start to use models as a Rorschach test, and they can put whatever interpretation into that model they want, even if the results of the model aren't particularly clear. So in order to avoid that phenomena, it's important to identify how results should be interpreted, who those results are directed for, and then tie that back again to the specific decisions. A few other issues, the precautionary principle came up, do no harm, make sure the model is producing results that aren't erroneous or misleading, and people are making decisions on them unless they're fully aware and informed. Another related issue is how biases and perspectives are used within the model. I know that all the stakeholders have different perspectives. This means that as people are given the flexibility to enter data into the model, and because it's a transparent model, stakeholders and users will have the opportunity to encourage model results to go in particular directions based on input. Explicit identification of the trade-offs is important. It's also come up today whether or not it could be used to have a structured discussion. I think that's a wonderful opportunity for the model, and I think it should be pursued. The key to having structured discussions is actually spending the time to structure the discussion and having ground rules about how a model and a conversation can work in concert with each other. A couple of other issues is so the comparison to other models is also going to become critically important. As models are produced, as other people have the idea to come up with a similar type of tool that prioritizes or ranks vaccines, how would this model be validated or compared to those other models, and is there an effort to state what the standards and expectations would be in that space? Despite the fact that there isn't anything presently, it's important to think about what would happen and what would be a comparable basis of comparison as part of the validation process. So where does the model do well? I think the model itself has is extremely transparent. I think that the approach to use the multi-attribute utility theory, despite the strengths and weaknesses of the approach, I think it's defensible. I think that you've clearly weighed in the report the alternative approaches, and I think that the choice to use it is appropriate in order to have a transparent model that has the slightest amount of complexity that could be dangerous. It does produce a set of results, which I think is very important, and it's also very flexible. I have a concern it may be too flexible if you're given the ability to choose what your outcomes are and how you're going to weight those outcomes, and also the data that you're going to input into the model. I believe that by not addressing the data issue and just handing over a very flexible tool, the model could be attributed for publishing just about any information that someone would like to have from an advocacy position. The model does help leverage thinking. There are computations that are too complex in order to think through without having it. And it does extremely well with information about endemic or occurring diseases, although I would identify a gap being in those diseases that aren't necessarily known, whether or not they're through a material threat determination from the DHS perspective, or whether or not it's an emerging infectious disease. That information wouldn't be available. The limitations, I do believe that information on disease and vaccination modeling of the sort that many people are doing in the academic universe and through the MIDAS program and others is critically important, because diseases transmit in different ways, and understanding that would be critical. The limitation in terms of gaming the model that I've mentioned a couple times, and also the danger of wrapping too many decisions together, because it sort of says this particular vaccine should be #1 on the list, and there's several decisions embedded in that about values and about measurement and about stakeholders and roles and responsibilities. So I think it's important to identify all of those various components to the extent that it's possible. So a quote, Albert Einstein said, a model should be as simple as possible, but no simpler. And I think that's very true in this situation. To think about what level of complexity do we really need to achieve in order to answer these questions, and then how do we stop ourselves there from going too far. So just in summary, from my perspective within BARDA, I would not want to abandon the current capabilities that we have for thinking about vaccines and medical countermeasures. We have a fairly sophisticated requirement and capabilities-based approach that we use. It would take several hours to explain, and it's late in the day, so I'll skip that. But I do think that we're certainly supportive of this and would like to collaborate and offer data where it's useful to think about whether or not this is something that could be more useful within our decision-making, in particular comparing across various categories of vaccines. I think this would be very useful for thinking about many candidates, so I think the real value in this tool is going to come not when there's 3 vaccines that are prioritized and ranked, but when there's an entire armamentarium of them, and all threats and vaccine candidates can be thought through in a systematic way with a similar data set. I think it's very easy to critique and very hard to develop systems like this, and so despite the effort to have a one-size-fits-all that is a solution for everybody, I think it's easy to forget how difficult it is in order to just develop a systematic, transparent way to move the conversation forward that does add value and provides information. I think the real challenge is likely to come when it stands up to scrutiny, moving from notional data to real data, whatever that means. So within the first couple of stages of the committee's work, I know that we're testing a couple of different vaccines to identify whether or not the model is calibrated. But when results are made, people start to have strong feelings about what the results say, which everyone knows, but it's difficult to say when you're either a developer or stakeholder of these tools. And then again, I want to emphasize one more time that all of these issues, I think, are supported by a thorough identification of what is the decision that's being supported. To the extent that that can be clearly articulated and written down in concise statements, I think that helps everyone understand whether or not this is work that fits into their organizational mission, how it fits in, and who needs to see it and participate in the process going forward. So thank you very much.
Thank you, Tim. Let's go to the phone now. Philip Eckhoff, are you there?
Good afternoon. Can you hear me?
Yes, we can hear you, and speak a little more slowly than you normally would. Go ahead.
Okay. Well, thank you very much for the opportunity to participate in this panel, and my regrets for not being able to attend in person. I'm the principal investigator of a disease modeling group in Seattle, Washington. We build large-scale computational models and statistical analyses for disease transmission in developing world settings, primarily for malaria, polio, HIV, and tuberculosis. We both construct mathematical models, construct analyses of disease transmission, and also build software tools to interact with these models. And then these tools and analyses are provided for free to funders, researchers, and public health professionals and implementers. And my comments are mainly in three different areas: ways in which the Smart Vaccines framework can be useful and best utilized, the importance of transparency and clear communication on what it can and cannot do, and some of the ways in which it can be enhanced by or complementary to dynamic modeling and more detailed sensitivity analysis. In terms of the ways in which it's useful, I very much like the interface. I think it's nice, clear, and clean, easy to work with. It seems to be a reasonable superset of attributes across stakeholders, although not every attribute would be relevant for all. I'd like to echo one of the things that Irene was saying earlier about everyone is a modeler, and everyone has mental models and pictures of the way things work. People build up expert opinions over long periods of time and developing reasonably well-formed, in many cases, conditional probabilities for reality. If something happens, what else is more likely to happen as a result? A mathematical modeling in general, and then a framework like the Smart Vaccines framework, is very useful as far as making assumptions explicit and allowing systematic explorations of the assumptions, of the sensitivities, and of the underlying data. It also allows higher dimensional comparisons than would often be easy in terms of trading off multiple different factors at once within just thinking through in your own mind. So I think that makes this type of framework very useful as a stimulant for discussions and as a way of making the assumptions, the priorities, and the opinions of each of the different participants very transparent and clear. It can be useful as kind of a first-pass analysis, sanity check on different rankings, and it can be useful to compare the different opinions from one to the other. It's very complementary to the type of models and detailed work that groups like mine would do, which is basically to construct detailed simulations of what a baseline transmission would be, and then the impact of that transmission setting with the vaccine introduced. Because it allows a lot more factors, a lot of these other attributes, a lot of these factors which may be very important to particular funders or participants to be examined, but in a more systematic way. But then it's different because of the way it lacks the handling of the dynamic transmission. So I think there's very nice complementary there, and it could be very useful to my group and other people that we work with. I think one of the biggest ways in which it's useful is it demonstrates the importance of data. It demonstrates how the outputs and the rankings depend critically on a lot of the input data, and how uncertainties and the lack of data in certain circumstances about incidence, populations, burden directly propagate into impact on the rankings. I think it is very important to be very careful about what it can and can't do, though. It's very nice that everywhere along here it says it's a decision support tool, but I think it's very important to reiterate that. It's not a decision driver, it just facilitates the decision. It's very important to be transparent in these discussions. What are the results? What are these rankings? How are they calculated? And for any particular person's analysis, when it shows their rankings of vaccines, what were the rankings? What were the attributes that created those specific outputs? It will be important for users and people who ingest the outputs that are generated to understand the sensitivity to the values and assumptions, to the underlying data quality or lack thereof, and to which subset of attributes was there. because as you change both which set of attributes are active and their relative rankings, the sensitivity analysis itself is going to change. One comment in the report was that these analyses could demonstrate the impact of improving vaccine delivery, but it's not entirely clear to me how this would be done in a careful and robust way, and so I think it would be important to clarify the communication on its capabilities. I think it's also important to understand the shortcomings of how it understands the impact of vaccination rollouts on community-level transmission and herd immunity. And I think it's very important to be careful about the use of the word validated. I think it's possible to do testing to make sure that the software framework does put out outputs that are consistent with the inputs that were given to it. But validated tends to, in the modeling community, would tend to mean that it says something about how you look at the model outputs. And every time a different user comes in with a different set of rankings, a different set of input data, that's going to be a different set of outputs. And you don't want to necessarily say that those particular sets of outputs have been validated, but just that the software has been a usefully constructed tool for turning inputs into outputs, and the outputs will be consistent with the inputs, but you're not saying anything about the validity of either the inputs or the outputs. And as a result, I think it would be very important to be careful about not ever saying the smart vaccine framework says such and such. I think this links back to what some of the things that Peter Hotez was saying earlier, as far as this is a useful way, this could be a useful way as far as taking a subset of attributes, and it's a useful way of being transparent about how a particular person views which of these attributes is more or less important. But it always needs to come back to the decision makers themselves and what are the key priorities in that framework, because this mainly provides an opportunity to actually number crunch through a user-selected specific set. Coming back to the dynamic models finishing, I think it's very important to choose an appropriate level of complexity for the model, depending on the question, wanting to keep it as simple as possible. But in any vaccine rollout, I think the impact on transmission is very important. In addition to the impact on transmission, there's also the effect of heterogeneity in the population. There can be geographic effects as far as variations in population density, spatial effects as far as coverage that can be attained within a given vaccination delivery infrastructure, and as well as access to primary health care. There are demographic heterogeneities in terms of mixing patterns, transmission, risk in terms of the underlying health status, nutrition, immunity. And as a result, there's going to be big differences in incidence and risk of transmission, as well as outcome given case. There's also going to be big heterogeneity in terms of the local healthcare infrastructure and the ability to actually deliver a vaccine and conduct vaccine delivery operations. The clustering of populations can be very important. A lot of the times, coverage is not allocated uniformly across the population, and non-vaccinated individuals will actually be clustered. So whatever fraction of coverage has been achieved may be much higher than the threshold needed to interrupt transmission in much of the country. But there will be pockets under which vaccine coverage is quite a bit lower. And a given specifying a single number for coverage rollout will not necessarily capture the full vaccine impact. Focusing mostly on developing world settings, which is where most of my modeling work is done, there is often going to be quite a few correlations between lack of access to primary health care, lack of coverage, and certain underlying risk factors. This means that individuals who have a lower probability of receiving the vaccine are often near other less covered individuals. There's a higher potential for transmission within those communities. If they're infected, they have lack of access to primary health care, which means that their outcomes based on the disease could be more severe, and a higher case fatality ratios in some cases, having received an infection. And so these types of things will be very important as far as these local clusterings, these impacts, and how that translates into herd immunity. Not necessarily for incorporation into smart vaccines, but as an important set of dynamics to keep in mind when thinking through these decisions. I think the one thing that might be interesting to include in the framework in next versions of the computational framework would be looking at the dynamic impact during rollout and the changes in natural epidemiology of the disease as the portion of immunity within the population due to previous wild-type infection begins decreasing as transmission falls off due to vaccination. And also actually implementing features which could look at the impact of vaccine delivery and operational enhancements. One last comment about both data access and outreach. I think the two of these things come together. As a tool demonstrates utility to the broader population and to the community of stakeholders, I think there's more of an incentivization to put their data in so that they can actually process and get relevant results for themselves. But I think it does have to build up towards a critical mass of utility and enlisting the larger community. But I think as outreach happens, access to data is fundamentally tied to that. So basically, just to summarize, I think there's ways this can be very useful as long as it's very clear what it can and cannot do and is used in an appropriate way. And I think there's some real possible synergies and for this to be very complementary to a lot of the dynamic modeling work that's done. Thanks.
Thank you, Philip. And last but not least, we have Robert Kolodner of Open Health Tools.
Thank you very much. It's a pleasure being here. Very fascinating since my background has nothing to do directly with vaccine and vaccine prioritization, as you'll hear in a moment. So it gives me kind of a fresh look and also may help me to see some things a little differently that may or may not be useful for the committee as you deliberate. It's really been fascinating, and what I've been hearing are a number of panelists who have been potential users and who are very much engaged. And we're saying, well, it needs to do this or it needs to do that. When you're looking for users of software, you want them to actually be engaged as opposed to just being neutral and walking away. And giving you lots of feedback about at least parameters or pieces that they need in order to fit their needs. Now, I've also heard different viewpoints even about SMART and what SMART is all about. And I'd recommend that you think about whether to look at what you're doing as really, in addition to the report that you'll be going through IOM, as creating 3 different products. One being the software, one being the modeling and the model, and the third being these data sources. And instead of tightly coupling them, thinking about them as being loosely coupled, and that fits with other things that I suspect you've dealt with and other IOM committees are dealing with. That what we're dealing with, especially when we talk about people in this technology or software or models, is we have a socio-technical problem, which is a euphemism for a complex adaptive system where every time we push here, the system readapts. And that's the environment you're smack dab in the middle of. And all 3 of these products are in their early phases. So I think that one of the risks that you have is whether you can allow them to go through being incubated, being immature, being imperfect, and going forward, because a number of the panelists are very, very much in the mainstream, and you've got a very early product that isn't going to hit mainstream needs, but may turn out to be useful for others. And at least when it comes to software, and I suspect in modeling, what we found is that you have to go through a process of iteration of try, fail, try, succeed, and then deploy. But they're small, iterative types of things. And when you release version 1, because you're time-boxed in terms of your horizon, it won't meet the mainstream. For those of you who've been around and been scarred enough by the technology, you usually don't let the mainstream touch things until it's version 3. You need to stay with the early adopters before then, and find those early adopters who are risk takers, who will go with you, who will take imperfect products. One example, when I was at VA, we had a medical center that took our new GUI front end, and they had to do 60% of the data entry in that, and then log on to another system and do the other 40%. Now, we wouldn't put that in almost any medical center, but we found some users who were willing to do that and take something that we knew was going to be imperfect and then be able to move it forward. And that imperfection is going to be both in the software as well, I suspect, as in the modeling. I was invited here actually to talk a little bit about open source. It was actually a colleague of mine who was at IBM and had the opportunity to create what may be the most successful open source broad user group, something called the Eclipse Foundation, that in the 5 years after it was launched and while he was the executive director, went from 9 companies to 800,000 and from 40 developers to 4 to 5 million worldwide. Because it was open source among competitors, but it hit the right spot to enable them to work together. And so I'm really talking about the software, not about the content. I'm not one who could address that. And I want to start by, we heard the term open source. I want to briefly go through that. It too is a Rorschach. I heard the term used a little while ago. One is that it's software that's funded by a single source and then released for widespread use. That's how government often thinks about that, but it's fully funded by one source. And that can be as much of a silo as any proprietary software, even though everybody gets to use it. There's also another version where there are multiple contributors. And so it's not all one source, in this case not all government funded, and that can be both the code and the data in the 3 products that you're talking about here. Another version of open source is that not only is it open, not only has it multiple contributors, but it's done in a way to allow more rapid modification and alteration and customization at a much lower cost, which just being open source doesn't allow that to happen. It has to be architected right to do that. And what's interesting about that is it provides opportunities for companies, proprietary companies, private companies, to make profit and to have opportunities for business models. It may be in the implementation or the support or in providing an alternative, like we do on the smart apps, where you want to pay a little bit more and get some more capabilities. And so that's another type of open source. Yet another one, and the one that I think is kind of aspirational, and I think that I'm hearing today from a number of the people who are on the panel, is to broaden the number of innovators, the contributors, by making it so easy that the end users themselves can make changes, can configure and can swap it among themselves so that they're actually part of the innovation. It isn't just a technology group, the geeks over here, but actually it can be kind of like Lego blocks, can kind of be customized because it's just easy enough to do it, that they can innovate. And in fact, that's what we saw in VA, that we had end users who were, it's the 15% of innovators, early adopters, but end users who can contribute. And there's a professor up at MIT who talks about democratizing innovation. That way is the way things go viral. And you have, talked about the 3 products. Any of the 3 could be successful when the others aren't, as long as they're loosely coupled. And if all 3 are successful, then in fact you get the greatest opportunity. But they're all going to be evolving, and you want to make sure they're not locked into one another, that you don't have to wait for software changes before you can evolve the model and vice versa. What's most important about that last part is that users, and again, this is experience that we had in VA, which was open source but public domain. When you put a tool out, and that's what we're talking about, you have one thing in mind with that tool. What we found in VA is when we put the tool out, somebody out there, the users, came up with ways of using that tool that turned out to be much more useful than what we originally designed it to be, and that you're not going to be able to conceive of. So make sure that the tool is sufficiently flexible, that the users, the countries, the organizations can use it to meet their needs. And we heard a number of organizations, a number of panelists who were talking about, well, I can use it for this thing. It's not what you had in mind for the vaccine prioritization, but I could use it over here. And the most important thing in open source, and I want to just briefly touch on 3 areas and make a couple of other suggestions. There's the areas of the project technology that differentiate open source, having to have a community and an ecosystem, and then a sustainability, unless you want government or somebody to keep funding it, which is not the funding stream that I hear that are here. So with the project and technology, all of the participants, all of the stakeholders, actually have slightly misaligned interests. All want things to go forward, want improved health, but each organization, each group has a slightly different interest. And part of what you want to do is to recognize that, acknowledge it, it's not bad, and to balance those so that the technology and the models that come out aren't overly influenced by one group or another, but you actually balance the power so that what comes out is neutral and broad. And then you bookend the requirements from high-end needs to very basic needs, from resource rich to resource or income rich to income poor or low middle income countries. And so that you actually cover a broad market and you're not doing something that would in fact increase disparities over those who have very few resources. Now the most important thing is you got to involve the users, and you have to do it early. And doing pilots that are kind of in a lab isn't as good as finding some early adopters who have a real need, who can take the tool, even as it is, and use it and give you feedback. Because that iterative feedback is what's going to make that tool really useful, as opposed to a theoretical, well, this would be nice and everything else. But I was also hearing here, well, we make our decisions our way, and that tool's not going to be useful. And if you go into some settings, there are going to be people who, right now, what's going on isn't perfect, but it's favoring me a little bit, and I don't know that I want a tool that's going to level the playing field. And those will be some of the last adopters. Don't go there to begin with. Find a few who are using it and can say, I'll use it even for something else, as well as some who are using it for the vaccine prioritization that you want. But get that done early. With the community and ecosystem, the more diverse, the better. And consider taking your project and getting it out there into an existing open source community, because there's lots of support there. And right now you're funding this all by yourself. You may be able to put it in to where additional resources, and you'll still be driving it, but others may contribute additional resources so that you can in fact get the benefit of some things that are out there and actually set it up so when it comes up, it may be able to talk not only within the population health arena of health IT, but the personal health and healthcare delivery, because ultimately you actually want that data to flow and flow into the data sources. And if you create a stovepipe, you're at risk for building a beautiful thing over here and then having to have a different project that opens up the connectivity. And then finally, on the sustainability, it turns out that the more you lose control, the more you win, because you want others there to benefit. Everybody needs to be there because it's in their own self-interest, enlightened self-interest, but they have to get something out of it. And then they'll start supporting it. And it's going to be from different parts of the community, different stakeholders, and you want to enable new business models as you move this forward. Thank you very much.
Thank you. It's been a really interesting and diverse panel here. I think we've heard some suggestions and ideas, though we didn't hear in the earlier panels. Let me look at the members of the committee and say that I am going to tell you that your homework for tonight is to take home at least one message or one new thing that we ought to be thinking about for our modeling work going forward, and come back with it tomorrow. So as you think about what you've heard over the course of the day, take home one message and bring it back to our committee discussion tomorrow. Let's open this panel to questions or comments by the audience or committee members or participants. I actually have a few, and you guys are quiet, but I know that there are some questions that we wanted to ask this panel. And I'm going to suggest that I'll put a question on the table, and it actually may apply more to specific members of this particular panel. So if you hear a question that's relevant to you, go ahead and raise your hand. If it's not really relevant to your expertise, it's fine to pass. One of the questions that I think we as a committee have on the table is that of how, of the trade-offs between different kinds of software and programming approaches. So we can take the model, and the initial model's been programmed in MATLAB, which is a rather specialized language, but it allows a lot of flexibility. Another way of programming the model would be to put in Excel, which is more accessible to end users in, let's say, developing countries, but perhaps less sophisticated and less quick about certain kinds of things. And I'm curious to hear the perspectives, particularly of the panelists who've been involved in modeling, what you would recommend to us.
It's a good and important question, and there's obviously trade-offs with every application that you use. If you're going to use commercial software, you obviously have to use something that people have. So MATLAB can be difficult unless you're providing a MATLAB license along with the software. Excel is great for what Excel does. Some people have made decisions to put their models and host them online, which is also something to think about if you have an intention to collect data about how people are using your model.
I'm sorry, they put their models in what?
If you put a model online.
Then
you can put a database on the back end, and then you have an opportunity to collect information about how people are using that model and how many users you have, where if you put a model out in Excel, you might be able to count a number of downloads of a model, but that's all the information that you're going to get. And then, really the number of choices for development platforms that are out there that you can freely distribute are almost unlimited at this point.
I think that's where having some real users is important, where I was talking about bookending. You actually may want to find an early adopter, maybe a Ministry of Health in a low middle income country, and say, what would be of help to you, especially if they have this process going. And then you want to find a high-end user, and you want to see how can you meet both needs. And it may be that you have somebody use the tool that they're used to, if the front end isn't simple enough. And if it is, you don't need to worry about it. But if they're used to using Excel, and look to see, can you create a tool that draws the data in an appropriate way and it makes it so that the more sophisticated software is using it. But I think you need to, what you don't want to do is put something out there that's so complicated that the person who's just getting started but has the need finds it overwhelming.
Great. Irene, did you have something to add? Okay. Do the panelists on the phone, would any of you like to comment on that question? And so hearing silence. I have actually two other questions, and I know it's been a long day, so not to prolong our discussion too much, but I want to take advantage of your expertise. I think that, in his last comments, Robert commented on the usefulness of having a lot of different field testers. And I heard, some interest, at least from a couple of the panel members, in the idea of test driving the model. Are there specific groups or people that you could imagine actually being some of those early field testers on behalf of the model?
Actually, let me be clear. At this point, I wouldn't want a lot of field testers.
Okay.
Okay. I'd want to find early adopters, because if you're a early majority and you touch imperfect software, it'll take you a long time to get back. So you want to be very limited. You probably want only 3, and just work with them, but not in an isolated kind of pilot. You want them actually to be using it in something that they need, and provide the support there. And if they're early adopters, you're looking for people who know it's imperfect, who know that as the committee had said, it's not meant to be the decision making, it's decision support or even decision facilitation. And they'll use it in that way and find ways that can be helpful to them.
So early adopters would have been a better way to put it. I'm actually sort of curious, and feel free to pass if you like, but I'm curious to know what John and Phyllis, and actually we have Philip Eckhoff on the phone still, I think. Are there people who would jump out at you either within the U.S. or outside the U.S. as, you know, kind of that interested to be early adopters of this type of model? Because it is some work.
I think that probably there are I think it would be advantageous for the committee to find one or two companies of varying sizes that could use it. So perhaps a big multinational with a big portfolio and a deep pipeline might be one to kind of talk about that interface between the internal process they're using and what kind of data they would want to get from the key governments that they interact with. So that partnership that you see between companies and the governments that they consider to be the major decision makers. And then I think a small biotech would be a very interesting company to try to use it and see how it would work for them. And then I think actually maybe a company in one of the emerging markets that's going global, where they're really going through this interesting transition from doing only what the government's deemed as the priorities for that country into actually globalizing, and may actually be in a position where they're starting to look for ways to do portfolio analysis with a different kind of rigor. And they need to both serve an emerging market that's pivotal, and they're working with the paths and gates of the world, but they're also looking at moving into new markets. And those might be three different kinds of users, but I still think it's important for the committee to look at who the primary users are going to be. So and this was whoever made that point in the beginning, was what decision is going to be made from the support tool? If the decision is, this is where the dollars are going to go, each of these different organizations make dollar types of decisions, but they're interrelated to each other.
Very good, thanks.
I would just add.
This is Philip Eckhoff.
Yeah, I would add that probably all the groups that make major funding decisions based upon development, such as the Gates Foundation, DFID, the WHO, and others, would be also potential users of this.
Okay. And Philip, I looked to you on the phone. Do you have other suggestions or comments for us on the potential early adopters?
Yes, I had two main comments along this line. I think one of the things in terms of rolling out new software, I think it's very important to start with a smaller group, because for a couple of reasons. And most importantly, it provides you a good opportunity to give them a high level of support. This becomes very important in terms of getting good feedback. You can get out to a large number of people who might click through a couple times. They might provide a few relatively small bits of feedback. But what you really want, as far as getting useful feedback to pushing it forward, will be for a small number of people to really use it quite intensively. And for this, it requires that for the software development team and for the modelers to really engage with a couple specific partners. I think in the work that we've done, we've rolled it out to at least one, usually two, example or exemplary partners in each type of user category that we're trying to provide services for. Both the researchers in terms of lab research, and then more the ecological and epidemiological researchers, and then the people who actually implement control programs. And this is a long process as far as sitting down side by side with them with the software, getting them up to speed on it, getting their feedback, and actually implementing features that they view as useful and necessary. But it definitely is, you want to look for the early adopters, as Robert was saying, and you want to work with them and actually provide the time necessary to make sure that they have the support and you can actually build up your user community and get the feedback you need. For who the early adopters would be here, I think it would be good to probably come up with at least two organizations who fund vaccine development. I would suggest probably the Gates Foundation at least one, and possibly NIH being another, and picking 2 to 5 people within each group and working very closely with them to where they can actually see how to use it. I think another group would actually be the vaccine developers themselves, either in industry or in more of an academia research lab type setting. And again, picking maybe 2 institutions with a handful of users in each place and actually working closely with them to where they can see it, and then give them the opportunity to see the iteration in the product, to where the features that they ask for, the things that they ask to be fixed, they can actually see the work and the time that they're putting into it having an impact on the evolution and development of the software.
Great, thank you. That's very helpful. So I personally have one last question, but I look to the participants in the audience. Do you have other questions? Folks are quiet. So let me actually pose one last question before we go to our public comment period. And this one actually is for John. And as you described your work with PATH, it occurred to me that there was a set of decisions that this committee considered during the first phase of our work, and that was, should we look at specific diseases, or should we look at using the model to look at variations of vaccines for existing diseases? So when you mentioned, for example, new versions of polio vaccines or the need for a pentavalent vaccine, that is actually something that the model could handle. And that's a little bit different from, shall we pursue a new vaccine against Chagas disease, for example. Do you have a sense of, the charge to this committee for this second phase of our work is to test the model using 3 new, I think the charge said new disease conditions, but this question's been on the table. Would it be more useful to look at these potential variations on existing vaccines?
Quite understand the question.
Yeah, so the question is, let's imagine we have 3 different diseases or new vaccines on which to spend our energy. In general, do you have a sense of whether it would be more useful from, let's say, a PATH perspective to look at new vaccines for existing diseases or new diseases?
I would want to give it more thought, but my first reaction would be that you would be probably best served by taking a one disease target that doesn't have any vaccines, and then perhaps a disease target that has new vaccines, but others are in development, and then like rotavirus, for example, and then lastly, perhaps one that's a lot more mature, say like pentavalent or polio, and then use 3 of those very different examples and see how the model performs.
Great. Thank you very much for your advice. So this concludes the 3rd panel. Thank you very much to our panelists. It's been really a great discussion. We've learned a lot.